welcome to this evening's New Hampshire Healthy Climates webinar series, Aging and Health in a Changing Climate, Insights and Opportunities for Healthcare Workers. I'm Judy Joy, a member of New Hampshire Healthy Climates Board of Directors, and since I'm a nurse and also among New Hampshire's elder population, I'm rather excited to hear what she has to say to us. A few announcements before I introduce our presenter. Please remain muted throughout the presentation. You can tell you're muted by checking the audio icon at the lower left-hand corner of your screen. It has a red dash through it if you're muted. There will be an opportunity for questions following, so you'll be able to speak then. The recording of the webinar will be posted to our website and also our YouTube channel. The recording will also be sent to all registrants following the presentation. And one final word. This webinar takes place on the Ndakina, which translates to our homelands and is currently New Hampshire and Vermont. Ndakina is the unceded traditional ancestral homelands and waterways of the Pennacook, Abenaki, and Wabanaki peoples past and present. We acknowledge and honor with gratitude the land, water, air, flora, fauna, and the beings who have stewarded Ndakina throughout the generations for over 12,000 years. And let us steward for the next 12,000. Our presenter this evening is Jenna Tipaldo. She is a PhD candidate in the Environmental and Planetary Health Sciences at the City University of New York School of Public Health. She is also a Demography fellow at that school's Institute for Demographic Research. In addition, she's an adjunct lecturer at Hunter College in their Department of Mathematics and Statistics. Her recent publications include in the journal Nature Climate Change, a framework for aging and health vulnerabilities in a changing climate, and in the Annals of the New York Academy of Sciences, Climate Change and New York City's Health Risk. Pretty impressive, I think. Jenna, the floor is yours.
Thank you so much, Judy.
You're welcome.
So I will start by acknowledging that I'm coming to you from Canarsie Lenape land in New York City. And as you mentioned, I'm here at CUNY. Yes, okay, great. Can you all see my screen? Okay.
Okay.
Excellent. So here's a quick table of contents of what I will be talking about today. First, I'm going to introduce some of the context in terms of the climate and the population situation. Then we will talk about the literature, what the research says about what is going on. We'll mention current events and then some next steps about what can be done. So, a bit about the national context, and then we'll talk a little bit about the local context. So, on the whole, the world and the nation is aging. Here's a quote from the U.S. Census Bureau, as cited by prb.org, that says the number of Americans aged 65 and older is projected to increase from 58 million in 2022 to 82 million by 2050, seeing a 47% increase. And the 65 and older population share of the total population is projected to rise as well. While we are seeing trends of population aging, we are not seeing it distributed evenly across the globe, nor are we seeing it distributed evenly across the country. We know that certain states and certain communities have higher proportions of older adults. We also know that the climate is changing, and we know that the climate is not changing at the same rate everywhere. We are seeing different impacts across different regions. Some areas of the country and some areas of the world are experiencing more rapid warming than others. Impacts such as precipitation changes, such as increases in precipitation, as are projected to be seen here in the Northeast, decreases in precipitation, as are projected to be seen in areas such as the Southwest. But in general, climate change, and this is a quote from the Fifth National Climate Assessment published in 2023 by the U.S. Global Change Research Program. Climate change is harming physical, mental, spiritual, and community health through the increasing frequency and intensity of extreme events, higher incidences of infectious and vector-borne diseases, and declines in food and water security. These impacts worsen social inequities. So, thinking about how this applies to New Hampshire, I did a little bit of a deep dive into some of the context. So, the State of New Hampshire Office of Planning and Development does population projections, as many states, the government, the national government, as do many localities, do population projections, thinking about what the future population will look like. Um, I come from a background of demography, so I can tell you that these population projections take what is going on right now and project those trends into the future. So oftentimes, when you look at these projections, they are making assumptions about what is happening with birth rates, with death rates, and with migration. So there is some sort level of uncertainty anytime we see projections. But in general, in the United States and in New Hampshire, we are seeing that the older adult population, commonly defined by demographers as age 65 and above, in New Hampshire is projected to grow in the coming decades. From 2020 to 2025, we are seeing an increase in the number of older adults as well as the increase in the proportion of older adults in the coming decades. I also did a little bit of an analysis looking at disaster displacement in New Hampshire, trying to capture some of the local impacts of climate change thus far. This analysis is unpublished. It's actually analysis that I did for this presentation, based on some data that I had already been working on for a paper that's going to be published in likely February. But this data is publicly available from the US Census Bureau, and it comes from this survey called the Household Pulse Survey. So the Census Bureau does their decadal census. So every 10 years, we get our census in the mail, and then there are people that come knocking on your door to make sure you've done the census. Well, the Census Bureau does other surveys as well, including the American Community Survey, which is done annually, and asks questions about your household. They also, since COVID in 2020, started this rapid release internet survey called the US Census Household Pulse Survey. And in this survey, they aim to capture things that are happening rapidly. They're looking at trends. So they were studying COVID-19. But another question that was added in 2022, the end of 2022, is whether people have been displaced from their home due to a natural disaster. So this data is from December 2022 to September 2024. And based on my analysis, again, this is survey data. So I do want to preface this when we're looking at the numbers that there's high uncertainty in these estimates. It could be higher, could be lower, but approximately 6,800 people, about 0.7% of the population of New Hampshire, report being displaced from their home in the last year because of a natural disaster. The average rate across the United States to this question for the whole country is about 1.5%, but this is still a notable amount of people. And the other questions they ask include what type of disaster were you impacted by? We can see that in the pie chart on the left here. We can see that the highest proportion of people said that they were impacted by some other type of disaster that was not provided in the list, which means the question needs improving. But we saw that about a quarter of folks reported that they were displaced from their home due to flooding, 18% from hurricanes, 9% from fire, 2% from a tornado, and 4% from multiple of this list. So if someone checked hurricane and flood, they would be put in this multiple category. This survey also asked questions about how long were you displaced from your home. Many people, the largest group, were displaced for less than a week. We have some folks that were displaced for more than a week, but less than a month, or from 1 to 6 months. 16% were displaced from their home for 6 or more months. And then 1 in 5 of these people who report being displaced, 20%, said that they never returned to the home that they were displaced from. So, thinking about this context of an aging population, and then people being displaced from their homes, we know that older adults may have certain vulnerabilities. So the literature tells us that older adults are vulnerable in many different ways. Older adults tend to have a higher prevalence of chronic conditions and disabilities, both physical and cognitive. They may have higher care needs. They may have limited mobility. They may need electricity or refrigeration. Of course, many of these things also apply to people who are not older adults, people who are below age 65, but we see higher rates in older adults. Older adults also tend to have challenges with thermoregulation. When we think about climate change, we know that we are seeing a rise in temperatures. We are seeing more frequent, more severe, and longer heat waves. Older adults physiologically tend to have a diminished sweat response, so may not be sweating as much, therefore may not have an ability to cool down as much. Older adults may also may not be as thirsty, so may not be drinking as much water. I can tell you this with my own grandma, who had Alzheimer's before she was moved into an assisted living facility. She really struggled with maintaining her temperature because she would be wearing a sweater and like not really have the sensation of being hot, and then she would be overheating. She wouldn't be drinking. And I'm sure folks may have experiences with this as well if you are a care person. So also there are social and economic factors that contribute to vulnerability of some older adults. Many older adults live on a fixed income, which can impact your ability to respond or adapt, especially in the case of an emergency, or if being displaced from your home, you may need to do some repairs, which require upfront costs, or to stay in a hotel. Even the process of evacuation, there are people that cite cost barriers as a reason as why they don't evacuate. They don't have the money to all of a sudden just pick up and go stay in a hotel or pay for gas or public transit to go somewhere else that's safe. Also, living arrangements. So, for example, older adults who live alone or maybe socially isolated may be more vulnerable due to a variety of mechanisms. And then also, you have older adults who live in care facilities. So, care facilities are responsible for the care of these older adults. And sometimes there can be challenges. For example, if the care facility loses power and is not able to meet the needs of those older adults. Well, in general, vulnerability is impacted by intersecting identities. So, not just the fact that someone may be older, but also the ability to access care. Certain groups may face institutional barriers and discrimination. So, I've given 2 examples. There are many more examples of intersecting identities that may contribute to vulnerability. But for example, people who belong to racial and ethnic minority groups, for example, African American and Black populations in the United States have experienced redlining. And in terms of housing discrimination, areas that have been redlined are more likely to experience hotter temperatures. And then also LGBTQ people may face barriers with regard to accessing housing in the first place, may be more likely to experience housing insecurity and homelessness. And then during a disaster, may struggle with the ability to stay in shelters or may face barriers. For example, non-binary people or trans people may face barriers with using sex-segregated facilities such as bathrooms or shelters. So here's a framework from the publication that Judy mentioned in my introduction. This paper was published in Nature Climate Change in October, and it's called A Framework for Aging and Health Vulnerabilities in a Changing Climate. Feel free to take a look at this paper. It outlines a lot of the literature and with citations that I went through on the previous slide, and then introduces this framework as a way to think about how climate change and extreme events eventually impact health. In our paper, we also provide some suggestions for researchers and ways of thinking about connecting data sets, because a lot of times when we try to study how climate change and extreme events, or even just environmental things in general, such as precipitation, impact health, a lot of these data sets are not really made to talk to each other. So oftentimes we as researchers have to figure out how to make them connect with one another. So we put some proposals forward if you're curious. But this framework helps us think about how these environmental factors happen on spatial and temporal scales with changing geography and various events that are impacting things such as migration. And then we have all of these different vulnerabilities and mechanisms of impact, such as some of the physiological vulnerabilities, as I've mentioned before, also, some of these sociodemographic vulnerabilities, the context of where people live, if they live in urban areas, might be more vulnerable to heat, extreme heat, such as the urban heat island effect, where areas that are more urban may experience hotter temperatures. Also, as a concern for rural areas, may experience barriers, access to care, access to healthcare, access to information, even Wi-Fi access, internet and electricity access may be of concern in certain areas. We also have these cultural factors, things such as social isolation, living and housing arrangements, risk perceptions, and behavioral change, adaptation. And these factors interact with one another and intersect in terms of thinking about equity, how different communities and individuals experience different layers of vulnerability. And all of these things impact various health outcomes that we can then study. So things like mortality, death, morbidity, rates of chronic disease or infectious disease, for example, looking at acute illness, so rates of hospitalizations or emergency department visits, and then also psychological well-being, how people are doing. So I also want to point to some other frameworks that have been published in the past few years as well. This one that I have up here is the first citation that I provided. It was published in the Gerontologist this past year, and it's a similar framework to the one that we have presented, but it specifically focuses on the effects of climate change on dementia risk and burden. So looking at Alzheimer's disease and related dementia as the health outcome, thinking about all of these different factors that may interact and intersect to influence health. I will also point out that the NIH has a climate change and health initiative strategic framework that has been taken down from their website, but does still exist in the publication The Lancet. So let's think about, we've talked about the problem, we've talked about the context, we've talked about what the literature says about our population situation, our climate situation, and our vulnerabilities in terms of health. So what is already being done? So I took this table from the Journal of Gerontological Nursing. I know we have some nurses here. This journal is one that does publish some papers that relate to climate change, so definitely worth looking into. And specifically, this paper was looking at older adults and sustained heat events, so some of these extreme heat events. And I thought it was a good example of what is already being done to help address some of these issues. So, in red are my annotations, and you can see the organization and really the mission and explanation of the tool. But we have we have the CDC at least right now, has been identifying geographic vulnerability through their heat and health index. We have the Alliance of Nurses for Healthy Environments working on nursing education to promote healthy people and healthy environments in the nursing profession. We have an organization called Healthcare Without Harm that's working to reduce the healthcare sector's footprint. We have an aging and climate change clearinghouse that aims to be a good resource. So I know there's an interest in in what resources are good to look to. I'm gonna have a whole slide on that later, but here's one example. There's also through the Rockefeller Foundation, there's some tools and resources about heat action plans. And then I'll also mention an example of a policy or program that is actually um, money that is being used to directly help people. And this is the Low Income Home Energy Assistance Program that's federally funded, administered by states, tribes, and territories to help address what is sometimes referred to as energy insecurity, where people may not be able to afford the energy that they need to stay healthy. So, for example, if you cannot afford an air conditioner, you may not be able to afford to stay cool in your home. Or even if you have an air conditioner, if your utility costs are very high, there are some people that will forego running their air conditioner because of the prohibitive costs of electricity. And this program helps provide assistance for either purchasing an air conditioner, to pay the bill, to work on weatherization, things like improving insulation, which helps reduce your energy bills in the long run, but can be a major upfront cost, and then other sorts of home repairs that are related. So I'll also mention something that's important to remember when we think about addressing some of these problems is that some of these solutions, some of these strategies, these actions, these policies have many different types of benefits. So climate action can actually benefit health as well. So this is a diagram from the US Fifth National Climate Assessment that was released in 2023. And it shows how some interventions that address air quality, for example, also impact climate. So when we are addressing air quality, we are improving health. We know that air quality is associated with health outcomes such as dementia, such as respiratory and cardiovascular disease. Areas that have higher rates of air pollution are also sometimes disproportionately Black and low income in terms of population. And I'm happy to provide some citations and further reading if anyone is interested in looking at that. But looking at some of these policies, looking at the implementation of electric vehicles, for example, and renewable energy, both benefit the climate and improve air quality. So building electrification is moving off of fossil fuels. It helps the climate. It also helps reduce some of the air pollution due to burning fossil fuels. So, on to current events. As you may have seen in the news, there have been quite a lot of headlines and new headlines every day. Researchers are facing a lot of uncertainty. A lot of these policies are facing a lot of uncertainty about funding. And funding is necessary to really drive a lot of this research forward, to drive a lot of this change forward, and to make sure that people are able to stay healthy. So, the NIH, as I mentioned, has a strategic framework for addressing climate change and health and has been a large funder of research addressing these things. The EPA has had a lot of grants that could help people. For example, in this New York Times article, they cite $147 million that could help people in Puerto Rico withstand frequent power failures. There's also some concerns about the availability of data and web pages, and the long-lasting impacts of many of these policies. So in summary, there's a lot of uncertainty regarding data collection and information access. Some data sets and resources from the EPA, for example, have been taken down. A few of the Census Bureau data sets seem to have been, some variables seem to have been altered or edited, as they are called. Particularly the variables that were there about sexuality and gender have been now named edited sex. There's concerns for research funding across the board and also particularly on these climate-related impacts. There are grants that have been canceled that study the contribution of climate change to name any health problem and have faced some funding cuts. There's also a lot of uncertainty regarding policies and programs to reduce emissions. As we mentioned, many of these policies also have health co-benefits. That's the term that academics like to use to describe the how there are also benefits to health, these health co-benefits. So for example, PM 2.5 air pollution is a risk factor for dementia, addressing some of these climate concerns. The emissions from burning fossil fuels emits carbon dioxide, but also creates these particulates you can think of as smoke that negatively impact health. So by reducing our burning of fossil fuels, we can also reduce some of this air pollution in the air, whether it be from converting to renewable energy or moving off of gas-powered cars to electric vehicles, or off of diesel in particular. That's particularly harmful. Um, and it's not clear how a lot of these initiatives that were put forth and tax rebates through the IRA, the Inflation Reduction Act, and some of these other policies that we've seen in the past decade or so, put forth by the federal government, also from the state governments across the country, how they may fare in this administration. Concerningly, there's also uncertainty in post-disaster relief. In the news last week, we saw that FEMA may deny disaster relief to the Carolinas, which experienced, particularly North Carolina in Asheville, experienced a lot of damage due to a hurricane in the late months of 2024. Um, so there's concerns about how that may impact people and also their health. There's also a lot of uncertainty about the health and healthcare impacts of some of these new policies. So the new federal budget that is being debated in the Senate right now seems to have large cuts to Medicare as well as Medicaid and food assistance programs such as SNAP, as well as uncertainty around how policies and programs to reduce some of the health impacts of climate change and climate-related impacts, so things such as heat and storms. Let's see. So I'm going to wrap up this presentation by providing some next steps. to advance research and apply research funding. So thinking about findings, not funding. So to think about how we can advance research, we can fill in some of the gaps in the knowledge about the mechanisms of how, for example, storms may impact health. Some of these mechanisms, really thinking about how does being in a storm impact your health? Does it impact your social isolation? Is it impacting your electricity access? Is it impacting your food access, your water access? What are the ways that we go from the storm to the actual health impact? Some of these may actually be intervenable. So, this is a really great way to pursue research that is really could be helpful. We also may want to get creative and collaborative with data collection. So I think that researchers can really benefit from healthcare worker insight and collaboration. So those of you who are healthcare workers on this call, I encourage you to get involved in research. And if you have thoughts and opinions, I, as a researcher, and am here to learn from you as well. And I'll open the floor up to questions in a few slides. But I'd be excited to hear some of your thoughts about what needs to be studied, how it can be studied, and working between researchers and healthcare workers can really help answer some of these questions. So we also want to consider the needs, challenges, and desires of older adults and other vulnerable populations, making sure that the people who are being studied or included in the research is a very important and empowering thing. Also, can be very helpful to research to actually know what's important if the people who are being studied are actually involved in the research process and the design of certain studies. And then also, we know that older adults may have unique needs or challenges, for example. So, if we are trying to study people with cognitive challenges, there are certain considerations you may need to consider when you're trying to access and study these populations. We also thinking about applying research findings, and this is a job for policymakers and maybe for healthcare workers as well, and researchers who are interested in implementation science. Thinking about how we can integrate findings into clinical practice. One example of that might be training healthcare workers, as one of the organizations I mentioned earlier might be interested in. So, for example, making sure healthcare workers are aware of signs of heat-related illness, making sure that they know what to expect after a disaster, that there are plans in place, but also that they can recognize some of these common things that happen after disasters or after heat waves, for example. We also want to improve communication with patients. So leveraging existing systems and relationships to reach the most vulnerable people in our society. Particularly during heat waves, there's a lot of research that says that people who are socially isolated, who may live alone, who may be lonely, those are kind of three distinct concepts, but often very related. May be very vulnerable to adverse health outcomes. For example, if you look to the Chicago heat wave and the Paris heat wave, there's some good books written on both of those and how vulnerable people in society, particularly socially isolated people, were at high risk of mortality. We also want to take what we know from research and what we're learning from research to improve emergency planning and preparedness. And that this like ties back into training healthcare workers, but this may be on like a larger scale, working across the healthcare sector, but also incorporating different state agencies or local city agencies, counties. Um, Thinking about emergency responders, first responders, for example, and then also policymakers thinking about how to develop policy to mitigate some of these health outcomes. And I'll talk on the next slide about some advocacy. Heat warning systems is an example of a type of policy that many groups have been working towards advocating for. So, one request I got from some of uh, you guys here at NH Healthy Climate was, okay, now that we have an uncertain federal situation and there's uncertainty around data and there's an uncertainty around the integrity of what is being put out by the federal government, what do we do? Who do we look for? Who can tell us who's reliable? And where do we find the most cutting edge research? So I've given a big resource, a big list of resources here, not exhaustive, not exhaustive. There are many other great reputable resources, but these are just some ideas as a starting point. So I would recommend looking to professional societies. So, for example, the American Public Health Association has a Center for Climate Health and Equity. Um, these professional societies are run by people who work in these fields. The Gerontological Society of America, which focuses on the study of older adults in the United States, has an interest group that also specifically focuses on climate. And then as healthcare workers, I would recommend seeing if your professional society has a climate working group. So, for example, the Nurses Association, if you're in a union, if you're in any sort of professional organization, through your either field or your place of employment, looking for whether the state organization or even some unions and professional organizations are national, seeing if there are any groups that have a climate working group. I would also take a look at academic centers. So, for example, Yale has a center on climate change and health where they do research, they publish reports. Some of the research is very technical and academic, but a lot of these centers also put out communications on social media channels that interpret their work and also are always looking for collaborators or host events that may be interdisciplinary. Harvard also has a Center for Climate Health and the Global Environment. And then I'd also recommend looking at organizations, both within the country and across the world, because there are many organizations that are working to tackle climate and health among older adults, but also across the whole population in general. One of the best organizations I think to look for cutting edge research is the Lancet Countdown. The Lancet Countdown is a subsidiary of The Lancet, which is a prestigious medical journal, if you're not familiar. And this initiative aims to track progress on health and climate change. They put out reports and policy papers. They have social media, they host events, but they really summarize a lot of the research that's coming out. They highlight research gaps, they highlight findings. The World Health Organization is another good place to look, affiliated with the United Nations. This week, they actually passed a global action plan on climate change and health for 2025 to 2028. And again, that's a UN affiliated organization, so it's very international. And a lot of countries had a say in what went into that global action plan. There are actually some accountability targets, some goals in there, hoping to help countries become more resilient to some of these health impacts related to climate change. I would also take a look at the European Commission, which has some resources on climate change and health that I've linked here as well. The largest source for information about climate change in general is the Intergovernmental Panel on Climate Change, which is affiliated with the UN. If you look at the resources from the Intergovernmental Panel on Climate Change, you're going to get a lot of very technical documentation, but I think that they do a very good job of communicating the overall findings in pretty approachable language if you look at the summary for policymakers, for example. So if you're curious about climate change in general and what is projected for the future, there are also Within the Intergovernmental Panel on Climate Change, they publish different sorts of assessments. So they have an assessment that looks at vulnerability and impacts. And there's chapters that talk about different regions of the world. I'll also mention here that the National Climate Assessment that I have mentioned previously does also have chapters that focus on different regions of the United States. And I think I'll point to that in the next slide as well. But the US does have its own climate assessment, which has been, let's say, paused at the moment because it is congressionally mandated, but all of the scientists have been dismissed from the assessment. So it's not clear what is going to be happening with the assessment moving forward. But previous assessments are available, and there are chapters specifically on health. There are chapters on different types of hazards, if you're interested in heat, if you're interested in storms, if you're interested in what are the impacts in the Northeast, there's a chapter specifically on the Northeast. So that is that on climate assessments. I'll mention more on the next slide. Stay tuned. But then there's also some organizations such as foundations and nonprofits. The Rockefeller Foundation is one that does a lot of work on climate change and health. They sometimes have initiatives, calls for research, but they also write policy papers, and employ people who specifically work on climate and health. As I mentioned in the paper earlier, there's the Alliance of Nurses for Healthy Environments. And then also finally looking to local groups. So groups like this one, NH Healthy Climate, is a good resource of people who care about this issue and people who are well versed in your field. So now I want to mention some New Hampshire specific resources. So I talked a little bit about climate assessments, and I mentioned that the US, like their National Climate Assessment, has specific chapters on different regions. So there is a chapter on the Northeast specifically, and they do outline things by specific states. So New Hampshire has a climate assessment. The most recent one was published in 2021. I've put the link here if you're curious on reading it yourself. They also link to how New Hampshire has a climate action plan and some climate related laws. I will mention that the New Hampshire Climate Assessment published in 2021, it could be a good resource. There's also specifically an assessment on climate change and health in New Hampshire. This is a bit older from 2014, but it could still really be a good starting point if you're looking to figure out what are the health impacts of climate change, what are the gaps in research, what are some things that we could continue to learn here. So some next steps, we talked about expanding research. We talked about trying to fill in some of those research gaps. We talked about applying what we know from research into clinical practice. I'll kind of conclude this presentation by talking about advocacy. So, in an uncertain federal situation, federal advocacy is important. Local action is critical. There are many different tools that can be used for advocacy. We have litigation, so thinking about the constitutionality of some of the actions that are happening, what are the rights that are at stake. There's also some litigation that encourages uh, either a country or a state to follow law that has already been put in place. So I can tell you, for example, in New York State here, we have a climate law that was passed in 2019, I believe. And that law says that we need to meet certain targets of greenhouse gas reduction. So some advocacy groups in New York have been considering or pursuing litigation to require that the state follow that law, for example. And litigation is a tool that professional organizations can pursue, that local groups can pursue, that individuals can pursue. I am not a legal expert, so I will not say more on that. But also another tool that is really accessible to everyone is lobbying your representatives. So looking at who are my state and local representatives, calling them, doing in-person visits, or many representatives do Zoom visits now. Sign-on letters, petitions can really show strength in numbers. A lot of representatives really take note of how many people are calling their office on certain issues. And then there's also direct action, so things like protests, for example. I also, in terms of advocacy, it's also could be really useful and important to build and leverage existing relationships, and to forge new ones. So if there are organizations, if your professional society, or if you have several professional societies, like if there's the nursing professional society and maybe the PAs and the doctors have their own professional societies, working together to push some of these issues to address some policy concerns. There's also advocacy that can be done in pushing for internal change, thinking about organizations and facilities. So, for example, the paper that I cited earlier mentioned this organization called Healthcare Without Harm. Their efforts to reduce carbon footprint of healthcare, so also providing resources for healthcare workers. So healthcare workers who are interested in their own workplace and how can we reduce the impact, the environmental impact of our own work. And then also, what is very important is engaging and organizing communities. So, a lot of my research focuses on older adults and other types of vulnerable communities. Um, there's a saying, nothing about us without us. And I think that's really important for not only research, but also translating research into action, making sure that people who are impacted by these things are engaged, consulted, and empowered to be part of the process and part of the change. So, thank you so much for having me today. I think we've got about 12 minutes or so for questions. I'd also love to hear thoughts or ideas because I'm here to learn from you too. I'm a PhD candidate. I'm writing my dissertation right now on how climate change, and particularly storms and disasters, impact health. I'm looking at older adults, but I'm also looking at the general population. And I really think that healthcare workers, people who are working with patients directly and communities directly, have great insight into some of the problems and issues and challenges that are being faced right now. So, um, please, I welcome any questions. Thank you so much for spending your evening, or if you're watching this at a later date, for spending your time with us.
Thank you so much, Jenna. We have about 11 minutes left, and we'd like to entertain any questions that you have. I would also like, before you even think about that, you can write your question in the chat, or you can raise your hand. And I see Joan already has. But before I say that, Joan, um, given what you've just said about developing communities, um, anyone who's listening should consider um, joining us, contributing to New Hampshire Healthy Climate so we can continue to do such things as your webinar. So, and the URL is on the in the chat. So anyone, Joan?
Yes, Jenna, thank you so much for your wonderful presentation. I really appreciated it. I was wondering if in the course of your research, you've looked at the incidence, the amount of our senior adult populations that are experiencing climate anxiety. We know this is a significant issue for younger populations, and I was just wondering if you're seeing it in older populations in the research.
Yeah, so climate anxiety is something that I've like personally done some work on in younger adults. Like I worked on a survey when I was an undergraduate with college students, but it's not something I'm really familiar with in the of like in terms of the rates and numbers in the older population. I will point to an advocacy organization that I'm aware of called Third Act that is a bunch of older adults who are in the third act of life, as they say, who are passionate about creating a world that is sustainable and healthy for future generations. So it is definitely something that is there. I'm not quite sure about the numbers, but I'm sure, and I actually can point to you probably where to find that research. The Yale program on climate change does surveys. They actually have a survey called, I think it's Global Warming's Six Americas. And they look at attitudes towards climate change in the United States, but they've also expanded their survey programming to outside of the United States. And actually, I think they have details even down to like the congressional district or something, like a very, very fine level of
Yeah,
geo.
I've seen some of their survey work. I just didn't know
Yeah.
they did this on these kinds of health issues. So thank you.
Yeah.
Appreciate it.
Yeah, no problem. Thank you for your question.
Hello, I'm Jenna, Pat Edwards. I'm wondering what you're seeing about families deciding not to have, or couples deciding not to have children because of anxiety about climate change.
Yeah, I think that's an emerging area of research. I definitely have seen some studies that are starting to look at that. That's also something when I was an undergraduate, we started to do some surveys with some college students, and we found, I think it was like 1 in 10 or 1 in 11 college students were not sure if they were going to have kids because of climate change. Um, in terms of the older in terms of the general population, I'm not quite sure what the rates are now. And I'm not quite sure who's doing that work as well. But anecdotally, I do have some friends that have considered having fewer children because of climate change. And the reasons are varying. I think it's not only thinking about what is my impact on the world by having a kid in terms of the carbon footprint, as some people like to think of it, or like the energy resources that you're taking up by putting another person into the world. But also, some people I think are hesitant about having children in an uncertain time. And I think that not only applies to climate change, but I think that applies to the current economic situation, to the current housing situation, the current wage inequality situation that we're seeing in this country. I definitely have friends, like I'm in my late 20s. I have friends that are not quite sure what they're gonna do in terms of having kids because they feel it's very uncertain and they're not sure that they want to bring a child or if they are planning to have a child to have maybe fewer children. So, thank you for that question.
Jenna,
Hi.
hi, this is Mary. I very much appreciate that you looked at New Hampshire specifically in terms of some of your intro remarks. Thank you for that.
Sure. Yeah.
One thing we're worried about here is rural hospitals closing.
Yeah.
And I'm wondering, are you seeing any emerging models in other states or in foreign countries,
Yeah.
especially as federal government programs might drop back,
Mhm.
that do give proper attention to the concerns about their aging population?
Yeah, I think I do have some colleagues who specifically study rural populations. I'm not quite an expert on that literature. From my understanding, there are major concerns about rural hospital closures. We know that access to care there are disparities between living in an urban area versus a rural area. We know that living further from a hospital or healthcare facility is an additional barrier to accessing care. And travel times in terms of emergencies are associated with outcomes. If you live further, for example, if you have a stroke and you may not make it to the hospital in time, for example. So, um, definitely concerns also with these cuts to Medicare and Medicaid. I've seen news articles that are concerned about rural hospital closures In terms of models, I'm not familiar with any, but there may be some out there. This probably falls within the field of health economics, I would guess, because economists may be able to model the closures based on the projected policies, for example. Um, but certainly these are major concerns, especially because there are, as I mentioned in the introduction, the United States is aging, but is not aging at the same rate everywhere. We have certain populations, certain areas of the country that are aging faster than others, partially because we're seeing lower birth rates. We're seeing increased lifespan overall, which means there are more older adults. But also migration is a contributing factor. So many young people, there's trends of people in general, but in particularly young working people moving into urban areas, which means that rural areas, places where they might come from, may have higher proportions of older adults, for example.
One of the things that I've wondered about is, as I retired and I I spent more time outside. I
Yeah.
spend more time in my garden. I spend more time hiking, climbing, doing all of those things. I wonder if anyone's ever looked at how that shift in aging behavior
Yeah.
impacts our exposure. And I'm thinking particularly because I spent the day in the garden
Yeah.
and I lost count of the number of ticks I had.
Oh,
I lost count.
wow.
Um, and so has that been an issue?
Yeah, I think there are surveys that look at how Americans spend their time. So one example is the American Time Use Survey, and I believe that's also from the US Census Bureau. And I'm not familiar with anyone who looks at the intersection of aging and time use and exposure. But I think that's a really interesting area for research. Of course, one of these impacts of climate change is um, higher temperatures means less cold winters. So we're seeing more ticks survive the winter, and even some of these tick or mosquito-borne diseases potentially maybe like the disease itself, the infectious agent, whether it's a bacteria or whether it's a parasite, for example, might be able to survive better in warmer temperatures. I think there's still emerging research on some of that. But yeah, I think that's definitely a concern. It's lovely you're able to spend more time in your garden, but the ticks
It
are
is.
a major concern.
They are.
And Lyme, for example, I learned this because one of my advisors was working on this. Lyme was not existent in New York City and Long Island until like 2000, the 2000s. So like we're seeing even emerging trends of disease, even already. And we see this with mosquitoes as well. We're seeing some mosquitoes and mosquito-borne diseases expanding their ranges already, and we're seeing projections of um, bigger ranges and more survivability of some of these insects that carry are their vectors for disease.
My elderly clock on my grandfather behind me
Mhm.
just gonged, telling me it's 7 o'clock and we're out of time. And I'm really appreciate not only you're taking the time tonight, but the time that you're spending to look at these issues and to look at how we might impact them. And so, thank you very, very much. And for those of you who are listening, remember that we'd like you to be involved in some way, even if it's not us. Remember, planting the tree is something that you do when you know that you're not going to when you're not going to see the shade. You plant the tree anyway. And that's what we should be doing. Thank you again, Jenna, and thank you for attending.
Thank you so much. Thank you everyone for being here, for spending your evening with us.